said you like my hair.
What is sleep disparity? Sleep disparity is sleep difference in level of quality and duration that causes by working hours, shift schedule, job demands, mental health, and workplace discrimination. So, there are two types of work that experience this sleep disparity. First one is blue collars. Blue collar is an manual work or workers, particularly in industry. And the second one is white collar. White collar is a worker who work in an office or other professional environment.
In Malaysia, the blue-collar workers often face rotating shift that is in the day, evening and night, which leads to an irregular sleep patterns, which also health issues such as insomnia. White-collar workers, on the other hand, face poor sleep qualities, which leads to poor mental health that is a common medical disorder. It may differ by population, but limited studies have been done in Malaysia, specifically among the academics. Similarly, the effect also has been seen in the US where because the worker who has an irregular sleep schedule that didn't work from 9 to 5 is increasingly needed to fulfill the demand of globalization and a 24-hour society.
Knowledge means understanding the cultural norms, values and behaviors that affect sleep quality in white-collar and blue-collar workers. The more you know, the better you can understand and bridge the gap between these two groups. It has been proven blue-collar workers who involve in high and enormous physical work demands within a limited time frame are more likely to be more physically straining by a Malaysia research. Evidently, by a US research also stated the same, but additionally, the mental and emotional burden are much more highlighted.
Actually, there's not much difference. White-collar work is stressful in both cases, such as constant email and mental pressure.
Evidently, based on a survey in the US, 48% of white-collar workers reported suffering from excessive daytime sleepiness. In Malaysia, many working adults had to work from home and struggle to balance family and work, which disrupts their normal routines and affects their food intake and lifestyle. As a result, the sleep quality of the working population can also be impaired.
But people from different occupational groups often live within distinct cultural system and also different schedules, priorities and stresses. For white-collar workers, they may view productivity culture, seeing that long working hours and short sleep as the symbol. For blue-collar workers, they prioritize their physical rest due to job demands because they got to have enough energy to support their job's workload.
Now, I will explain about the intercultural concept of social class that will be narrowed down to occupation due to our research. Firstly, social class referring to social status of a person due to the income, position or maybe academic achievement. In relation to our research, white collar clearly hold the higher position in social hierarchy since their professions involve their excellent performance in academic field, while the blue collar usually are undervalued as they involve in dirty work such as construction. In this case, white collar receive more recognition and benefit as the blue collar needs to work twice times harder just to have sufficient food for house. Consequently, blue collar sleep quality is lower. Evidently, the average income of the blue collar from Malaysia and USA is much lower than the white collar. And not to mention, white collar also receive another 3 benefits that the blue collars do not receive. That is, first, medical health care, secondly, paid leave, and thirdly, flexible hour working.
Practical reasoning to this is maybe because the white collars tend to be more educated than the blue collars. So when this happens, society recognizes the white collars more than the blue collar workers. So by that, we could say that the blue collars need to work twice as hard in order to receive the normal amount of salary received by the white collars. So if that happens, if they do not get enough rest, they will have lower job performance, higher risk of injuries, and absenteeism.
Sleep disparities are influenced by job type, with blue-collar workers in Malaysia and the USA losing sleep due to physical demands and long hours, while white-collar workers struggle with stress and workload. Job-related pressures affect sleep across all social classes. Work culture impacts sleep differently by class. Blue-collar workers face poor sleep from physical strain and shifts, while white-collar workers lose rest due to stress and productivity pressures. These reflect differing values and versus performance.
Now, examining sleep disparity across occupational groups. It is evident that both Malaysia and the USA share similar patterns. The blue-collar workers face physical strain with limited benefits, while the white-collar workers face mental stress and high performance expectation.
This reflection emphasizes that addressing sleep inequality requires not only individual effort but also organizational and societal changes, such as better working conditions, flexible schedules, and the importance of rest for all workers. When we understand these cultural and structural factors, it can enhance our awareness of how occupation shapes daily life and health outcomes.
Problem number 3. Over 80% of jobs worldwide are sedentary or seated. With more and more jobs every day being made electronic, it leads to more workers going from physical jobs to desk jobs. And with the ability to bring computers home, you can also keep working when you get home, giving you less time to be physically active, decreasing rest and sleep conditions, disrupting your circadian rhythm. People being sedentary for so much of the day can lead to insomnia, including trouble falling asleep, interrupted sleep, and tiredness during the day. These symptoms are capable of not appearing for up to 10 years. While you can't necessarily stop working desk jobs, you can find solutions. Some solutions include taking breaks during your shift to take walks, using a small walking pad or office-sized treadmill. You can incorporate walking to and from work. And at a corporate level, bosses can enforce policies enforcing mandatory breaks for exercise during the day. And they can also make any possible meetings walking meetings, so you're walking and talking instead of sitting. And companies can also give their employees discounted or free gym memberships in order for them to be more able to go to the gym to get the exercise that they're not getting. Overall, physical activity is very important for the sleep and rest of both your body and your mind.
In the United States, work overload, job autonomy, and jobs that require long work shifts, late and irregular hours all contribute to sleep. With work overload, there is a difficulty initiating sleep, which is trouble falling asleep, difficulty maintaining sleep, and then difficulty waking up for work. For the initiating sleep, they average 6.6 days a month trouble falling asleep. For maintaining sleep, they average 5.3 days staying asleep per month, and then waking up for work is an average of 5.0 days per month. For long and late shifts, such as healthcare workers like doctors and nurses, and protective services such as police and firefighters, they report difficulty staying and falling asleep. Some solutions for this problems are personal level solutions, such as before or after work, trying to complete exercises such as walking, jogging, yoga, or stretches for at least 30 minutes, because exercise is proven to help make it easier to fall and stay asleep. Another one is turning off all electronics, including phones, computers, and televisions, at least an hour before you fall asleep. This is because the blue light from the devices makes your brain more alert and awake, so turning it off for a while can help reduce the blue light before you go to sleep, and it makes it easier to fall and stay asleep. Taking melatonin gummies as you get ready for bed can also make it easier for someone to fall asleep. Increased production and release of melatonin can help signal your brain and body that it is time to go to sleep, and will help you sleep through the night. Some more society/policy making solutions include a new mandate that requires companies and employers to allow for flexible scheduling. This will allow for workers who constantly work long, late shifts to work different hours, and which can reduce stress and increase the sleep quality. Another one could be a new mandate that sets limit on work overtime or overload based on the previous week's hours. This can help reduce overwork fatigue and make it easier for people to get a more quality sleep and wake up easier. The final society/policy solution is a mandate that requires employers to schedule at least a 10-hour break in between each shift in order to give employees enough time in between each day's shift to rest and recover, and so that employees can sleep enough and sleep well throughout the night. All of these solutions are potential ways to help increase better sleep in the United States.
Sleep is essential, yet in Malaysia, how much we sleep and how well depends heavily on what we do. Different occupations face very different sleep challenges. A large study of over 11,000 working adults found that 54.7% of workers report getting less than 7 hours of sleep per night. That's over half. That's far below the recommended minimum, and it's not evenly spread. Some occupations fare much worse than others. For example, shift workers, those in manufacturing, and nurses often report far shorter sleep, higher sleepiness, and more disrupted sleep. Take nurses in tertiary hospitals. In one study, nurses averaged only 5.8 hours of sleep per day. That's nearly 2 hours less than a typical minimum needed for healthy functioning. Shift workers in the electronics manufacturing industry also report significant sleep deficits. A study there showed that about 30% of shift workers participants did not get an adequate amount of daily sleep. Sleepiness increased noticeably by the end of or late long shifts. An occupation isn't the only factor. Hours worked, overtime, commuting times, and additional responsibilities like childcare also weigh in. In many jobs, older workers, those with children, smoking history, and people under stress are more likely to sleep less. Moreover, occupations that require shift work or unpredictable schedules, like manufacturing, healthcare, or emergency services, compounded these risks. Disrupted cardiac rhythms, night shifts, irregular rest periods all degrade both the quantity and quality of sleep. Sleep disparities by occupation have serious implications for health, well-being, safety, and productivity. Poor sleep increases risk of accidents, chronic illness, burnout. Employers, policymakers, and individuals alike need to pay attention. Better shift scheduling, rest policies, sleep hygiene education, and support for mental health can help reduce these gaps, because in the end, good sleep shouldn't depend on your job title. Now that we've seen how sleep disparities affect Malaysian workers, what can be done to fix them? Solutions must happen at both the national and individual levels. At the macro level, the government can enforce stricter labor laws, limiting excessive work hours and ensuring mandatory rest between shifts. Public health campaigns can raise awareness about sleep hygiene, while more funding for sleep clinics and occupational health screenings can help workers identify and manage sleep problems early. Workplaces also play a huge role. Companies can improve shift scheduling, provide nap or rest zones, and educate managers on fatigue management. Even small changes like better lighting for night shifts can improve alertness and recovery. At the micro level, workers themselves can protect their sleep by keeping consistent schedules, avoiding caffeine before bed, and getting sunlight exposure after waking, and creating quiet, dark sleep environments. Regular exercise and managing stress also makes a big difference. From national policy to personal choices, every level matters, because good sleep isn't a luxury, it's a necessity for a healthier, more productive Malaysia.
So go